There's a lot of different things that can lead to the peripheral artery disease. And one of the things I do is I work with a lot of patients who have chronic kidney disease. And with the chronic kidney disease, I do an analogy with my patients. And what I tell them is that the kidney is what's going to be filtering out all of the end product from your metabolism. So everything that we eat is usually going to be filtered through either the kidney or the liver. So it's not 100% all going to go through the kidney, but there are some specific nutrients that do go through the kidney that need to be filtered out of the blood on a regular basis. And so what I tell people, it's the good analogy here is if you have a backyard pool or any pool for that matter, and if it's filtering out everything from the pool's water is going to stay very clear, very, you know, it's going to look great. You're going to want to be in it on a hot day. But let's say there's some leaves from a tree that are falling into the pool and they start to clog that pump that's actually filtering out the pool. Or if the pump's just not working properly for whatever reason, eventually you're going to notice visibly a lot of change in that water. It's going to start getting dirtier. It's going to start looking murkier. Nobody's eventually going to want to get in that pool. So essentially, that's a good analogy for what our kidneys do. Our kidneys will be filtering out the end products from some of the metabolism of the foods that we're eating. So what happens is that when these nutrients start to build up and they're not being filtered out on a regular basis, it can lead to other diseases. So, this is where it starts to contribute to other diagnoses, such as the peripheral artery disease. So in addition to not having the kidneys properly filtering, there's a multitude of things that over time, if it's not addressed through the diet, and if it's a very severe stage of chronic kidney disease, like stage 4 and more into stage 5, you'll see a lot of the patients that will be going on to dialysis. If their body's just not filtering properly, then this is where it ultimately leads. But in some cases, it's not 100% preventable to keep the disease from progressing, but the diet has such an important role in preventing the progression. And I have actually worked with a couple of patients where they have reduced their stage of kidney disease and gone from a 4 to a 3. So, but I'll be honest, it is one of the toughest therapeutic diets out there because there's so many foods that have to be monitored and kept in check with portion sizes. And it's, looking at labs pretty much every month, unless they're stable, then sometimes the nephrologist will be okay with not looking at the labs for, like maybe another 3 months or so. But obviously that's usually this is all very individual between the patient and the physician. So, one of the things that, that we can do to help prevent that leading to the issue with peripheral artery disease, because peripheral artery disease is where the blood flow is just not flowing properly. And I want to take it a step even further back and say that a lot of times, again, not every situation or every case will be caused from this with the chronic kidney disease, but a lot of times it starts with diabetes. If they're not controlling the diabetes, then it starts leading into, again, that impediment of the blood flow and the building up of all of these other, and in this case, it's the sugar, and then the sugar starts to lead to the breakdown of and having kidney disease and a multitude of other diagnoses as well. And then the kidney disease compounds into not having that blood flow into the extremities of the body. So, again, diet is really, really important here. But also movement. What I talk to a lot of the patients is I try to encourage them. A lot of them are, when I see them, a lot of them are in some pretty, dire situations with their chronic kidney disease, because They may not have had anybody working with them leading up to a latter stage of chronic kidney disease. So even just sitting still, they can, march in a chair. They can use some, canned goods to use to do arm lifts and things like that to help, just getting the blood flowing and helping that kidney. And again, looking at the filtration rate with the kidney, that is the eGFR. So the lower that eGFR goes, the worse it is for this blood flow that's going through the body, and it's not filtering out. And the main nutrients that we look at obviously are protein. The end product of the metabolism is going to be amino acids, and those are the ones that are going to be filtered through the kidney. So, watching the protein levels, whether it's coming from an animal source or even a non-animal source, we really want to make sure that they're not getting an overload of that. And something also, right now that's very popular is the keto diet. A lot of people who may be at a predisposition for diabetes as well as for chronic kidney disease may not even know it. And so if they're following a trend, a fad diet, with something like this, with keto, where it's high protein, and they're going to see some weight loss because you're cutting out the carbs, and it is actually going to help with controlling blood sugars if they are diabetic. But over time, it could be potentially creating damage in the kidneys, which is then going to also lead to that impediment of the blood flow, which can lead to the peripheral artery disease, or actually contribute to it. It might not be necessarily the main contribution to peripheral artery disease, but it will contribute to it. So really wanting to contain that. And again, it's recommended about have 50 to maybe 60% of the protein sources coming from a non-animal source. Because a lot of times too, if patients are getting their main source of protein from animal sources, there are some natural acids that are in the protein, like the meats, that can also lead to other things such as gout. And so we want to try to keep that in control and have more of the protein sources coming from more of a non-animal source, like a plant protein. And one of the ones that they can use is something called quinoa. It's almost like a grain, but it does have a protein in it. So if someone's not diabetic, or even if they are diabetic, just keeping the portion control on that size of the serving to about a half a cup or less at a time. But it's a very good source of protein, a non-animal source of protein. And then pea protein, a lot of people are not familiar with this, but it's something that's been out for probably about the last 5 to 6 years. I actually go to a lot of the food conferences and have met with the food manufacturer, one of the largest manufacturers for pea protein, and it's just the green pea. It's a vegetable, but they will pulverize those peas into a powder. And that powder can be added into soups, it can be added into casseroles. You can even sprinkle it onto salads. So that's a way to get a protein, but get a protein from a non-animal source. So, but again, this is also, something that a patient would really want to be working with a dietitian, because once you start cutting out the animal sources, you're also cutting out your main source of iron. So a lot of chronic kidney disease patients will have low iron and will need to either have it supplemented because they just are not going to be able to eat enough of the foods that naturally contain it to get the amount to meet their essential needs for that. So that's one of the main things that we look at. Also, potassium is a huge component with the chronic kidney disease. And with that, the potassium is a big component in muscle contraction. So again, the patients are going to want to be watching their potassium as well. But if they have high potassium, over time, that can actually change the heart rate and can be so severe if it's not caught over long term that it can actually lead to death, because it is changing the heart rate. So, watching the salt substitutes, a lot of the salt substitutes will replace that sodium with a potassium product. So that's one thing you want to really try to keep your eye on. And this is really good for anybody, really. You don't want to be getting a ton of potassium. And if you are working outside or if you're exercising and in a very hot and humid environment, and you are a healthy, normal person in terms of like not having any chronic kidney disease, you may need to replace the electrolytes, and that is one of the electrolytes. But for the chronic kidney disease patients, and I would definitely say keep that at a minimum and make sure you're keeping your eye on that. And so another one of the nutritional components that are part of the chronic kidney disease is the phosphorus. And phosphorus is really important for strong bones. And it's in literally every cell of the body. It's part of the phospholipid membrane. So it's something also you're going to find in literally every single food. So this is not an easy nutrient to really reduce, because you're going to find it in a lot of, pretty much every food out there. But that being said, there are some foods that are naturally higher in phosphorus than others. So we just try to keep those products that are naturally higher contained to maybe about 3 times a week. Keep the portion sizes to about a half a cup or less when you are eating them. And then again, it's important that these patients, continue to get their lab work so that, the doctor and any dietitian that they're working with can help them make the appropriate modifications so that we're keeping this all in check. And then sodium is also a big component as well with the diet. So sodium can cause fluid retention, which again, if that's another one of those nutritional components that is also regulated with the kidney filtration. So it can lead to water retention, and over time that can also lead to fluid buildup around the heart, which can lead to congestive heart failure. So we would want to kind of keep the sodium in check as well. So to about 2,000 milligrams on the sodium and the potassium, both or less a day, is typically what I recommend for the patients who are around CKD stage 3 or less. Anything above that, we really kind of have to be a little more restrictive. So it's kind of in a nutshell, the components of the chronic kidney disease diet. Obviously, there's a lot more to it than what I would have time to go through on this segment, but this is how it all leads to, other diagnoses. So, if a patient is controlling the chronic kidney disease and they're getting some movement every day, and I usually try to tell people, especially the ones that have, they might be obese or they've never really moved, and now they have a lot, people feel bad when their values are out of the normal range. So a lot of times they're not feeling like getting up and just going for a walk around the block, or even trying to move around, even in their home, if it's, too hot outside. So even just any movement they can do is going to help that blood flow, so it's not pooling at the bottom of their feet, and then causing other damage down the road. It really goes hand in hand, and we do, and I personally as well try to look at the whole patient. It's we can't just isolate one area of the therapy. It really all works together. And if something's not being incorporated in to their routine on a regular basis, it can over time lead to, other diagnoses such as the peripheral artery disease. But really, this is something that, we really try to work with these patients and on a very personal, individualized basis. But these are the overall components for the diet for the chronic kidney disease.